This is the Shahid Shah Show. Straight talk on building, buying, and investing in digital health. No hype, no buzzwords, no speculation. Just what actually works, maybe what doesn't, and most importantly, why. If you're building healthcare technology or buying it, this is where reality shows up. I want to tell you about a governance committee I encountered at a large regional health system. It had been running for 14 months. It had produced 4 detailed reports, reviewed 11 vendor proposals, held almost 42 formal meetings, and it had made exactly 0 decisions. Not 0 good decisions, mind you, 0 decisions. Now, I don't want to make anybody feel bad, but this committee's most recent output was a report recommending the formation of a subcommittee to further evaluate the governance framework that would eventually guide their AI strategy. Now, I'm not making this up, and it's not, of course, everywhere, but it is pretty common. This state of governance in healthcare technology today is a little confusing because everyone has a committee, everyone has a framework, they've got a process, and in a remarkable number of organizations, none of it produces an actual decision. Instead, it produces activity, which makes it feel like decisions are being made. Agendas and meeting minutes and carefully formatted decks that summarize other decks, analysis of analyses, vendor demos of vendor demos. Now, what it doesn't do is produce clarity. It doesn't produce direction. It doesn't produce the kind of accountable, documented choice that allows an organization to actually move. Today's episode is about why that happens, what it costs, and what to do about it. Now, the way to think about this is, in general, when you're making IT technology decisions, and IT people are involved, and a whole bunch of other folks, like cybersecurity, it could be the compliance team members, etc. It kind of feels like you have to go through this governance as a decision or a consensus building process. What's not clear is, will the governance actually lead to decisions that let you make choices about things that subject matter experts, the doctors, the nurses, the admin staff, the people working on claims, the finance folks, people who actually hit up against patients and what patients need are the ones that these new, very slick, very cool AI systems can help improve, but they need decisions in order to make that happen. So let's start with a misconception that I think is at a root of most governance failures. Governance gets treated as a synonym for due diligence, and governance is not about due diligence. The implicit theory is this: if we study something long enough, the right answer will become obvious enough that no one actually has to make a call. It'll just be made automatically. That's not governance. That's the organizational equivalent of standing at a restaurant for 45 minutes, reading the menu, not deciding on what you want to eat, and wondering why you're still hungry. Now, the actual purpose of governance in my world is very simple. Governance exists to make decisions, not to study decisions, not to discuss decisions, not to form working groups about decisions, but to actually make them. Because AI is one of those brand new but very useful technologies which don't need long decision-making processes before they get implemented and started to be tested and evaluated by subject matter experts. In a world in which the time between specification of an application or the need for a tool and the distance to when it was delivered could have been weeks, could have been months. So you want to rethink and think again and get the requirements right, etc. in the old days. But if the decision to do something and the actual implementation of the code to do that something is mere hours or days or weeks away, you want to make the decision as quickly as possible to go do the action. That's where AI helps a functioning governance structure make decisions faster, make those decisions more transparent, and then document how and why they were made. That's the job of the governance system. That is not the normal job of governance systems in the past, but that is where we have to be headed today. So I'm hoping you're going to share this episode with a lot of your other colleagues in order to convince them that governance is supposed to reduce ambiguity and accelerate responsible action. In too many healthcare organizations, unfortunately, it's doing the opposite right now. It becomes a respectable sounding reason to avoid committing to anything. And that's not a small problem. The gap between the announcement and action in healthcare technology is already enormous. Now, in the past, you could have made the argument that it needed to be because the healthcare technology that you were implementing was causing a lot of strife and implementation hurdles and training and education, etc. And good governance is supposed to close that gap. But when it fails, it widens it. So pilot programs should no longer run for 2 years and never convert to productions. AI initiatives should not get announced in press releases while committees are still debating evaluation criteria. Vendors present to the same organizations 8 times over 18 months without ever receiving a decision. That is not a good way to drive AI projects today. At some point, we all have to realize that that's not governance. That's a waiting room. Now, let me talk about what this looks like from the builder's side, because there's a cost to governance failure that most healthcare systems never see, but they end up paying for it anyway, embedded inside every vendor contract they sign. When a startup or an established digital health company tries to sell into a health system, they have to figure out what organizations actually want. In a well-governed organization, that should be relatively straightforward. Now, I'm not saying that this is trivial, I'm not saying it's easy, but the priorities should be documented somewhere. The decision criteria somewhere should be clear. The authority structure should be visible. That's the whole point of governance. But in the organizations I've described, the ones where governance has become theater, vendors are essentially guessing. The vendors are brought in on their own dime, doing their own work, taking their own risks, but without the guidance that they need from the health system itself. They don't know if the CIO decides or the CMIO decides on whether there's a steering committee that's deciding or whether it ultimately lands with the CFO when the contract hits a certain dollar threshold. The builders don't even know if organization prioritizes Fire-based integration or will accept HL7 version 2. They don't know if the clinical leadership is driving the initiative, if they're being dragged along behind it. So vendors do the only rational thing available to them. They present broadly. They cover every possible angle. They design demos that try to speak to every possible stakeholder because they have no idea who the stakeholder should be. They build decks that anticipate every possible objection, and then they run this process 8 times, adjusting after every meeting until something sticks. That's an expensive process, not just at the builder side, but imagine all that time being held up at the organization that actually wants to buy these tools and technologies and capabilities, the ones that are not making the decision. It takes cycle time, which translates directly to headcount. It takes engineering time when a vendor customizes a demo or builds an integration proof of concept that's never going to go into production. It takes legal time when a vendor drafts a contract and gets negotiated 3 times because the internal priorities shifted between meeting 4 and meeting 7. Again, because the governance committees didn't make the decisions about what to ask for. None of that cost disappears. It's getting priced into the deal, the implementation fees, the annual license, into the professional services engagement because they know that the decisions are hard to reach. When a health system's governance is opaque, vendors charge more. Not because they're being unfair, because they're accounting for the uncertainty cost. That's another cost that's even harder to see. When internal teams can't get decisions out of governance, they find workarounds. Think about it. They buy tools on department credit cards. That is the shadow IT, shadow AI. They pilot things quietly without formal approval. They build informal alliances with vendors that bypass the official process entirely. This is called shadow IT, and it's the market's answer to governance paralysis. Decision paralysis, decision avoidance creates shadow IT, creates shadow AI. And it's very expensive. Shadow IT is not cheap. It's not just the direct cost of ungoverned tools, but in the integration debt that accumulates when 40 different clinical departments are running 40 different platforms that were never designed to talk to each other. Every one of these shadow decisions that happened outside governance becomes a problem that someone eventually has to pay to untangle. The decision debt then causes technical debt. So what should governance actually look like from the builder side? The organizations that are the easiest to work with share a few things in common. They've defined who has authority to make each category of decision. Now, in a healthcare system, there's no way that you can say, okay, this is the guy and he's going to make all decisions. It almost always going to be a consensus decision. The consensus decision is okay as long as you've defined who is in the consensus. And as long as that consensus is generally static, not changing weekly, bi-weekly, where one guy comes in and another woman steps out, you have to set these time limits on evaluation cycles. The best run organizations publish their governance outcomes. So they make the decisions about the consensus team, they make the decisions about priorities, even if they're not perfect. Document them and present them. With AI, it is so easy to now create this kind of documentation after the transcripts are all captured from the meetings. Don't treat them as trade secrets. Don't treat them as internal financials. The decisions themselves are the artifact, and you got to explain that to your builders that you're bringing in. Now, if you're not bringing anybody in and you're building this all internally, same thing happens. If your internal teams are building, what decisions are they building off of becomes the questions. When organizations publish these decisions, vendors and your internal builders stop guessing. Startups and your internal builders don't feel like they're being pushed around or having the rug pulled out from under them every once in a while. Sales cycle gets shorter, implementation gets a little bit smoother. Now, transparent governance is not just good process. It's a direct way to reduce what you pay vendors because you're removing the uncertainty premium from every deal that you sign. If you're just tuning in, this is the Shahid Shah Show, where I cut through the noise in digital health and talk honestly about how healthcare technology actually gets built, bought, deployed, and paid for. Today, we're looking at why governance fails in so many healthcare organizations and what it actually costs when it does. I want to give a name to what accumulates when governance stops working. You heard me say it before, decision debt. This is every time you don't make a decision, you're piling on some sort of debt. You've heard of technical debt in many cases, but I call this decision debt. Decision debt is built up when organizations just consistently delay, avoid, or obscure choices. Every time a committee says we need more analysis instead of choosing a direction, the debt increases. Every time authority is unclear, the debt increases. Every time a decision gets made in a meeting but never gets documented, the debt increases. Just like technical debt, financial debt, it compounds. Interest upon interest compounds on this kind of debt. In the early stages, it feels manageable. One deferred decision here, one extra round of research there, but over time, the organization becomes slower, more fragmented, even more risk averse in a almost a self-reinforcing cycle. Teams stop trusting governance because they've learned the decisions don't come out of it. Vendors get inconsistent signals. Shadow IT proliferates because internal staff build workarounds. Internal staff have to get work done regardless of whether decisions are made or not. And now, so many staff members realize they don't have to wait around for IT or for a governance committee or whatever to make these decisions. They can go around and make their own decisions. When they make their own decisions, they're not doing it in a way that captures the organizational needs. They're doing it in a way to make their lives easier because they have to see patients in the next hour. They have to pay a claim. They have to go and focus on denials. There's a bunch of things that they're going to have to do. And the decision debt that's piling up is not something that they care about. They need to move and be actionable and figure out how to get their job done. So, how do you actually pay down decision debt? Let me give you a practical set of things that works because abstract advice is kind of crazy because everybody says, oh, you need governance just to make themselves sound smarter. But better governance is the thing that ends up in another slide deck in another committee folder. Start with the most uncomfortable step. Force decisions. Every governance forum should produce a decision within a defined time window. Not a recommendation, not a summary, a decision. If a committee cannot reach one, it's escalating immediately to whoever has authority. Not in 3 months, immediately. Now, this is the problem in healthcare is no single person has the authority to do everything. That's okay. Figure out if there's a two-person team, a three-person team, the consensus that has that authority. Now, all of this sounds obvious. It's the problem that most organizations do not enforce. Second, after deciding to say every forum that you come into a governance meeting, you must make a decision. After that, write it down and keep them visible. Show when a decision was made and not made. For each category decision, document who recommended, who approved, and who is accountable for the outcome of the decision. not the outcome of the failure or success of the decision, but just the outcome of the decision. Who made it? So we know who to go ask when something goes wrong. Can we change the decision, etc.? This is not about making it hard to have accountability. It's trying to make it easy to know who made the decision so we know that if a pilot fails, which is very normal, pilots should be failing all the time. Otherwise, they're not really pilots. So when the pilot fails, should we change the decision? Or do we continue checking for more things coming in the past in the future? So if people aren't sure who decides something, decision debt starts accumulating from the moment the question is asked. Now, keep a decision register over time. So you documented the decision, just put it into a folder. Just make sure we know that the decision was made and that the register might just be a folder in SharePoint or OneDrive or Box, etc. This is the most underused tools in healthcare organizations, and it almost costs nothing to implement. Seems very obvious. Maintain a simple running log of the decisions you're making. And if you don't have a running log of decisions, that's your governance problem. For each entry, figure out what was the problem being solved, the options that were on the table, the decision that was made, and the reasoning behind it. Not the analysis, not all of the quote analysis on top of analysis that were done, the decks, etc., but the decision that was made. This solves two problems at once. It prevents the same debate from recurring every 18 months when a new executive joins and wants to relitigate settled questions. And it creates institutional memory, and this is super important. This institutional memory becomes context for AI. Every decision you make and the documents that go along with it become context for the AI to then end up being used in the next prompts, etc., for the next meeting and the next decision that gets made. Now, in the end, you want to publish what you can. Some things cannot be published to vendors outside, other things can. This is the step that most organizations are most reluctant to take, and it's the one with the most leverage. Publish the summaries of your governance decisions. In the public ones, you don't have to put everybody's names on it, just the decisions. In the internal ones, put the names. You want to celebrate the fact that decisions were made, not that the decisions are going to be good or bad, but just that the decision was made. Of course, you don't share confidential things. Of course, you're not publishing your budget or your negotiating position. You're just telling builders, the market, or maybe just your internal staff, what the heck do you want? What are you trying to solve? Every time a vendor or your internal team has to guess what your organization needs, that uncertainty is the cost. That's the decision debt. It is the interest that is piling on that debt. And publishing those decisions eliminates the guessing. Now, what you should also be doing is time box the research. I'm not saying that you need to make decisions super, super rapidly and then you don't have to worry about any research. Of course, you're doing research. Of course, you're doing analysis. Of course, you're doing conversations in between the meetings. But time box that research. Know that the research's purpose is to arrive at a decision. Pick a window, 4 weeks, 6 weeks, 8 weeks, whatever fits the decision complexity. In that window, you make the call with the information you have. The single biggest driver of decision debt is the belief that waiting longer is going to produce the perfect answer. It's not going to. Tech decisions are judgment calls made under uncertainty upon more uncertainty. The goal is not to eliminate uncertainty. It's to make an informed decision quickly enough that you can learn from it and adjust. Because if you don't make the decision, the AI tool that you wanted to throw together in 2 days doesn't get made. So instead of taking 2 days to put together and begin trying something out, it takes you 2 months to even make the decision or accidentally have shadow AI, shadow IT, etc., come into the middle. Now, everybody using AI is fantastic, but they forget to use AI to actually help governance do the actual work. So use AI to help governance actually work and help you do the work that is necessary during the governance process. Most healthcare organizations are running AI pilots while their governance process looks like it did in 2009. That's inconsistent. AI can help governance directly, and it's practical. Use AI to summarize vendor proposal and surface the real trade-offs instead of reading through 300-page RFP responses. Seems obvious. A lot of us are doing it. Others are not. Use it to draft decision memos that clearly document what was decided and why. Use it to capture meeting discussions and convert them into structured records in real time. Use it to generate the kind of publishable summaries that help external market understand your priorities. Now, let me talk to you about how you know if any of this is working. Like if you're doing it, what happens if it's done right? The temptation after implementing a new governance process to measure the wrong thing, to count how many meetings you held, useless. To count how many documents you produced, again, useless because AI can produce more documents than we can. How many stakeholders were consulted? None of this is going to tell you whether governance is functioning. The only thing that's going to tell you governance is functioning is whether decisions are being made. There's a few things worth tracking, though, right? So, what do you track? Decision throughput. How many decisions are governance bodies producing per month? Not agenda items, not presentations, not things that you're reviewing, but actual decisions with documented outcome. Now, these are just, it could be a Word document, it could be a Microsoft Excel line in item in a spreadsheet. But when organizations count this for the first time, the number is always lower than anyone expected, but that's okay. The decision latency is another thing you can track. How long does it take from identifying a problem that needs a decision and then actually making the decision? Track this across your categories: vendor selection, pilot approval, build versus buy, production rollout. And if routine decisions are taking 3 months, decision debt is already high in building, and there's probably a little bit of shadow IT, a little bit of shadow AI here and there that's causing grief over time. So now, redecision rates are also something worth tracking. How often is the organization revisiting the same decision within a short time frame without anything else changing? If no simple app came out, or no decision was made to write a custom tool or install a tool, and now decisions are changing, try to figure out why. There's nothing wrong with that. You just got to figure out why frequent repetition of the same debates is happening. Now, it's a strong signal often that the decisions were never actually made. They were just deferred with a thin veneer of process on top. There's one more metric that's got to be discussed. Ask your vendors and startups a simple, direct question. Do they understand your priorities and constraints without needing multiple meetings to figure them out? If the answer is no, and in my experience with most health systems who are busy doing important things, the honest answer is no. Your governance system is failing externally. Often it's failing internally as well, but for sure it's failing externally. And then that leaves the market, the developers, the vendors, and the builders guessing at what you want, which means it's wasting your time. You shouldn't necessarily care whether the builders outside or vendors outside are losing time because they're wondering what you're doing. That's not the important part. It'd be nice to care about humans outside. The reason you care about this is when the builders don't know what you want, they're bothering all your staff with the same questions over and over again. They're going to one executive and then another. They're trying different pathways to solve the problem. So governance isn't failing because hospitals don't care about making good decisions. It's failing because governance got confused with research. Research is important, but research without a decision is not governance. The fix is structural, not motivational. Define who decides, set the time limits, document the reasoning, publish the outcomes, measure by decision, not by activity. Now, the business model case here is straightforward. If you don't have a functioning governance system, you're paying more for tech and you're taking longer to do it. And if you get the governance properly, you'll get better tech because when you tell the market what you actually need, the market can actually build it. The vendors will give you what you want, the more specific you are with how you want it. If you want builders to build what you need, internal or external, tell them what you actually need. And again, that sounds obvious. Now, I really, really want to hear from you on this one. If you've worked inside a governance process that actually worked, where decisions got made, documented, acted on, tell me about that. What made the difference? I really want to tell these stories. And if you have seen decision debt in action, committees that ran for years without producing a real choice, shadow IT that metastasized because the official process was too long, too slow, vendor relationships that collapsed because your organization couldn't tell anybody what it wanted, I want to hear those too. So remember, as usual, post your experience at GitHub, email us, do whatever you want to do. Just send us a simple email, catch me on LinkedIn. I want to hear the failure stories. Don't keep them to yourself because we want these kinds of things to help teach each other because no one actually knows what they're doing. as much as I talked about all this and make it sound like it's super confident, all of us are trying to figure out how to do good governance. And that's not bureaucracy. When it's working, you're going to barely notice it. When it isn't, you notice everything slowing down. You can't figure out why. Well, now you know why. Decision debt caused by delayed decisions. This is the Shahid Shah Show. And until next time, keep innovating, stay practical, and be kind to the people doing hard work in complicated places. We'll see you next time.